Here at WellBridge, one of the primary goals that we had when we designed the facility and implemented the model was to make sure that quality was centric to every procedure that we perform here. We have a kind of a circulating statement inside the facility that we don't really care for the term standards of care because we feel that that doesn't advance the quality of care. We prefer the term excellence in care. When we define quality, we created a metric system that allows us to analyze the data from each type of surgery, from colonoscopy procedures all the way through general surgery and larger orthopedic cases and everything else in between. Those metrics are broken down into two different categories. The first category is called sentinel events. A sentinel event is an event that you never want to happen, essentially. Some example of sentinel events are wrong site surgery. Procedure was performed that was actually the incorrect procedure. The other topics in that category would include wrong site block, which is a regional anesthetic administered that would numb the wrong nerve that innervates the area that's being operated on. Patient burns, patient falls, medication administration errors, those kind of things you just never want to happen. And so we monitor for those things, and thankfully, when it comes to those categories, we've avoided those up till this point, and we'd like to continue to do so. The second area that we are focused on when it comes to quality has to do with our quality metrics and scoring system. So that is always an evolving list of topics and areas that we're constantly adding to. Speaking to the quality metrics and scoring, at WellBridge, our all-cause hospital transfer rate is still 0 since 2021 from the day that we opened, and we're very proud of that. Our 7-day hospitalization rate is 0. Our post-op wound infection rate is 0. I hope that each and every one of these quality metrics and scoring categories remain 0 into the foreseeable future. Oftentimes, we are asked for data as it pertains to one or more of these metrics that we are measuring, and we are more than happy to provide that information to any group, entity, or employer that would like to see the numbers. In fact, we have process review committee and data analysis done on 6-month intervals, so we don't wait the full 12 months prior to generating data so that we can actually generate data on a more frequent basis. In the event that something were to change, it would be caught earlier on. And each day, clinical staff provide recommendations, suggestions, or areas for process improvement to make sure that our numbers are industry leading.